Welcome to Collide Health's Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions and treatment options. Today's guest is Dr. Kathryn Bass, the Medical Director of the Level 1 Pediatric Trauma Center at Oishei Children's Hospital. Today, we'll be discussing gun violence, its impact on families all across Western New York, and how physicians and communities are coming together to stop it. I'm Mike Hughes, and this is Medically Speaking. Dr. Bass, thanks for joining us today. Gun violence is a topic that's on everyone's mind these days after several of the school shootings. Talk a little bit about what we see here locally here in Western New York. Is gun violence on the rise? Do we see gun violence?
Mike, we've been sensitized to gun violence because of the media attention that it's been given recently with the Parkland High School shooting. And if you were able to see some of the coverage nationally, it was very moving, the firsthand account of the kids who were involved in that. What we did here locally was to support that movement with our own march here. So many of our physicians joined the community in March and helped out to support, raise awareness. If you look at the data, Mike, that we keep in our database, in the last 10 years, we've seen roughly a handful of injuries a year. And unfortunately, in the last few years, we've seen an uptick in that, more towards 8 to 10 injuries a year.
You are at Children's Hospital, the Level 1 Trauma Center, so I know what we're saying we haven't really made a dent, but at least you and the team there are prepared and ready should something like that happen. Talk about the trauma center and the care that's provided there.
Yeah, so thank you for asking about that. We work hard in our community to provide the best possible care, and I want to tell you a little bit about how that happens. We invite the American College of Surgeons to come and review our care, and it's a national accrediting agency. And the way we become a Level 1 Pediatric Trauma Center is that we provide training and staffing so that we're prepared for any kind of injury. And I'm proud to say we just had our second review, and we just received another round of Level 1 Pediatric Trauma Center accreditation. So that's really important because it allows us to be prepared for any kind of injury, including these gunshot wounds.
Sure, third-party validation of the trauma center, the team, the program, the services.
Exactly.
So there's a story recently in the news where there's a young boy who is recovering after, I think it's now 2 summers, after being a victim of gun violence. The story about Danielle Bibbs. Mm-hmm. That's an example of someone who got the right care because he was brought to Children's, but also a victim of gun violence. So I know you and the team were involved in his case. Talk a little bit about the youth that are impacted by this, as well as maybe the impact on their families when they see something like this.
Well, as you know, gunshot injuries can be lethal. They're incredibly devastating. So the impact on the child is significant. Sometimes these kids don't return to their normal baseline. So you can imagine how that affects not only themselves, but their families. And it's really an injury that goes beyond, we talk about a zone of impact, and the zone of impact is in the family and in the community. So it's huge. It's something that as a community we really need to invest in as one of our major public health threats.
Sure. We talked about ACS coming in to review the trauma center at Children's. You guys have been at the forefront of emergencies and disasters. Do you prepare for these types of mass casualty incidents? And if so, how do you do that?
We do. We have monthly mock traumas. So internally, we have teams that gather, and we do this on the day shift, we do this on the night shift, and we pick different scenarios so that we're prepared to handle anything that might come through the door, and we assemble as a team, and we run through not only the process of how we assemble and what resources we need and how we transport patients from one unit to the next unit, and we dive into different kinds of injuries, and we also dive into different kind of resources that we have to mobilize. So this allows us to be prepared for those individual events. And then we also train on a grander scale. We train for mass casualties with our Kaleida emergency department and with our Kaleida emergency management system, where we are essentially gathering resources in the entire system for multiple mass casualty kinds of events.
Sure.
And then really even on a regional level, we practice and we work with ECMC, who is our adult partner in the region.
Right. You mentioned the team at the trauma center. It takes a special person to work in that field, whether it's nursing, physician, or any other clinical staff. Is there support that's available for the team if they have to go through one of these incidents?
Yeah, what we do, Mike, is called a debrief. So after the initial resuscitation, we'll spend a few minutes, the team that has worked together in the ED, and we do this really unit by unit, and we just take a look at what just happened, not really even so much focused on the medical side. Sometimes, yes, how did the process work? But many times just how it left the impact on the provider. And we have, in this way, we have support amongst our teams,
Sure.
and then we also have chaplain kinds of services. And, it's the kind of thing that, again, to refer to that zone of injury, it really makes a big impact on us as healthcare providers also.
Sure. You mentioned how earlier this year the Children's Hospital physicians, as well as some of the local community physicians, came together after the Parkland shooting. What else do you see that's going on nationally with the physicians and gun violence? I know the American Academy of Pediatrics recently had a story about this. So what are you seeing nationally?
Well, I'm a part of an organization of pediatric surgeons, the American Pediatric Surgical Association, as well as a member of the Academy of Pediatrics. And both of these organizations work together to advocate for higher awareness of the impact on firearm injuries in our community and nationally. And so we've made it a big agenda item in our advocacy over the last several months particularly. So the front page article in the Academy of Pediatrics this month is about advocacy for firearm injuries. And there's three major points. We're really talking about money for research. Unfortunately, a number of years ago, money for firearm and gun control measures was really curtailed. So we're working to roll that back. The second thing we're really working on is trying to raise the age for acquiring firearms. And lastly, just common sense firearm injury kinds of prevention, like limiting assault weapons or high magazine rifle cartridges, these kinds of things.
So Children's Hospital is doing their part. Obviously, they're on the receiving end of these injuries. There's a new community initiative out there amongst the emergency services community, physicians, nurses, called Stop the Bleed. Tell us a little bit more about that program.
Yeah, thanks for asking. That's a really important program that was initiated through the research that was done following the Sandy Hook shooting. And essentially what was discovered when researching that is that the injuries to the extremities caused life-threatening bleeding. And so one of the surgeons locally came up with a program to teach the public how to apply tourniquets. So it's a quick and simple course, an educational intervention in the community to teach people how to respond to these mass shooting situations.
What's your message for parents or teens as you move forward, knowing that we're going to see this type of issue in the headline? So what's your message?
I think the most important thing to understand is that parents may have a feeling that guns keep us safe. And this is where the research is really important. Turns out that just having guns around is actually a huge risk for kids. And our goal as pediatric surgeons, as pediatric providers, is to keep kids safe. And so safe gun storage is really important. That's probably the number one thing, is that most kids know where the guns are in their households. When they go to other houses, they may not know that. And so I think it's really important for parents to understand they have to keep their guns under control, and safe storage is really important.
Good. Dr. Bass, thank you for joining us today. Thank you for all your help with children, as well as serving at the Children's Hospital.
My pleasure.
Thanks again for joining us on Medically Speaking. I'm your host, Mike Hughes. We'll see you next time.